Hello and welcome back to 10 Minutes With. Today I'm joined by EURORDIS President Avril Daly to do a temperature check on the Rare 2030 recommendations. Thank you for joining us, Avril.
Oh, it's lovely to be here.
So could we start with a bit of context? What are the Rare 2030 recommendations and why are they significant?
Well, there are 8 recommendations that have emerged from the Foresight study that was undertaken about 5 years ago now, where over 200 stakeholders ranging from people who are involved in policy, people from patient groups, obviously, science, industry came together to look at what is the future of rare diseases from a policy perspective? What are the key priorities and how do we see things moving forward? And there were some key results from that. And I suppose first and foremost, the piece that came out of it was the need for an action on rare diseases from a European Commission perspective that is fit for purpose for the future, towards 2030. What is this community going to look like? From there, also, we had to look at, well, what does this mean? What is contained within such a plan or a strategy?
And so really it's a roadmap for where we want to be in 10 years' time. Well,
exactly.
What was 10 years' time?
Exactly.
when the Foresight study happened.
Exactly.
And so looking back over the past 5 years then so far, what are the areas where we've seen some of the biggest achievements or the most progress in your opinion?
Well, that's a big question.
Sorry.
because there has been progress, and I think it's very important. And I think it's very important as well to say that, for people who are living with rare diseases watching this, what they feel is, if we've done this or we've done that, or we've had a policy initiative or a report or whatever it may be, how do they feel about it? Is it impacting their lives? And I think that's important, because advocacy is a slow train.
Yes.
And it's important that everybody's on board that train, and that takes time.
Yeah.
But to answer your question, fundamentally, there has been progress. There have been a lot of initiatives. There have been a lot of discussions. There have been a lot of support from the European Commission. We have had developments within our ERNs, for example, which we always say are a one-stop shop for people to get, to support people living with rare diseases from diagnosis to therapeutic stage. I mean, and everything that comes in between. So there's been more development there. But more needed for sure. We have looked at there's the European health data space, where there's work happening there to look at how do we again curate and share and capture that data. We've had the moonshot, which is really important in the context of therapeutic development, and many outputs. I suppose the Rare Disease Partnership with EURORDIS is really important to look at how we can work more closely together in research and innovation, and also embedding the national plans at a national level, and again supporting that, but also and importantly embedding our ERNs at a national level, and coming back to that point, that is really important. So there's been a lot of progress. There's been a lot of energy around this space. Where we're lacking, and I think it's important to say, is a framework. And
that overall
that
umbrella.
overarching umbrella. And that goes back to the first recommendation of the Rare 2030.
Is there something that you are particularly proud to have been part of when you think back to the progress that has been made so far since the Rare 2030 Foresight study?
Well, yes. I mean, I think that it's a collective pride in the community, and the fact that we work well together across stakeholder groups. And when you drill into the issues, you'll find that most people are thinking the same, and that their priorities are the same, regardless of which stakeholder group that they are representing. What I always think of is where did 2030 come from in the Foresight study? It comes from that collaboration that was very much evident towards the late kind of 2009, 2008, 2009, when we were looking at the development of national plans and strategies across Europe. I mean, some countries had quite an evolved situation, quite developed national plans, where others had none at all and never had had that approach, and sort of we came to a situation where by 2013 most member states had a national plan, or certainly in the years following. So why was that successful? And I think it was because there was an engine driving it. You know, we had the EURORDIS, the European Committee of Experts on Rare Diseases, and sometimes you need that engine. It's coming back to the point about a framework, that that sort of collective approach to drive strategy forward, to consider it and evaluate. And Rare 2030 did that, you know, when they came together, and now we're 5 years into it, and it feels like, you know, okay, we don't have a new strategy, you know, but we know we need one, because you know, the evolution and the dynamism of our community is enormous. We're progressing all of the time, so we need that strategy. We need that to understand, like, what are going to be the areas that we need to focus on as we move forward.
Definitely. And I mean, you've touched on obviously the major one being the need for a European action plan on rare diseases, but are there any other areas that you think, maybe more specific areas that would fall under that action plan, that you think should be a priority moving forward for the next 5 years?
Oh, there's so much, Rhiannon, that we could say. I suppose, you know, you always take it back to the ranch, as my colleague Anne back in Ireland always says, you know, what's happening back at the ranch. And that means what's happening for the patient, what's happening for the person living with their disease on a day-to-day basis. What are their key challenges that could be improved through a policy framework, so that what we're doing, you know, at a collective level, at a European level, is being felt, and it starts with diagnosis. You know, it starts with end-to-end support upon diagnosis for a patient, be that, you know, the diagnosis, care, social care, maybe rehabilitation services, mental health services, all of these things, to look at the holistic approach to specific disease areas. I think that's something that's always going to be important, because that's what matters to the person who is lost in a diagnostic odyssey. The Rare, you know, 2030, we're standing here at a halfway point. We have achieved a lot. We're in challenging times, very challenging times. We are in an unknowable reality, and I think the world feels like that right now. You know, every region, Europe feels like that right now. However, we have to hold to what we have achieved and the foundations to move forward, which we have. And I think Europe is in a very strong place. You know, we have these structures, we know how to talk to each other. We can move forward, but we have to listen. Because if we don't listen, we can't learn, and if we can't learn, we can't lead the change that we need. So it's really, really important not to be deflated, not to feel diminished, not to feel a little lost. You know, we've faced challenges in the past. We will always face challenges as a community, but I think working together, we're definitely stronger.
That optimism, I think, is so important, but also such a lovely message for the people at home. To end on, what would be your message to policymakers, to healthcare professionals, or just to the general public to garner support for the Rare 2030 recommendations?
I would say to all people, all citizens of Europe, that rare diseases represent the largest constituency of people who have an unmet need and a health requirement. And we are here, and we're willing to engage with all stakeholders. Policymakers need to engage, healthcare professionals need to engage, innovators need to engage, and they do to a large extent. But some don't know how, or you know, if they can, or what exactly to say to a patient, or can I say this, can I say, what questions can I ask? The advice that I would give to them is to come to EURORDIS and ask the question and say, you know, I really would like to talk to patients about a specific issue. That's all possible. So it's about picking up the phone or sending an email and connecting, and from that connection, you know, good, amazing, and you know, really, I would say innovation can come, innovation of thought and innovation of practical in the practical sense. So yeah, just reach out and
Get
remember,
that ball rolling.
we're all here together, and the successes that we have had have come from a place of common ground and communication and really structured collaboration.
Amazing. Thank you so much for sharing your expertise with us today. I think that's a wonderful note to end on.
Thank you.
You have been watching 10 Minutes with me, your host, Rhiannon Walls. Make sure to tune in next time.